Good evening. You're watching NDTV's Solution Summit as we face our worst ever health emergency. What does India actually do to fight it? India versus COVID. We're now heading to cross 3 lakh cases a day. Joining me is the man who's really in charge of the government's thinking on this, Dr. V.K. Paul of the NITI Aayog. Dr. Paul, how have we actually reached here? I remember on March 30th listening to your press conference where you said the situation is going from bad to worse. Yet we find that certain key measures like making sure that export of remdesivir is stopped, that controlling the price, that medical oxygen is now being imported only over the last 2 days. If you all knew it was going from bad to worse, why are we now emergency fighting in the middle of the worst?
Well, the preparations for facing such an eventuality, the blueprint for this was available. We had prepared this in September when the cases were escalating. Unfortunately, the lull that came afterwards, both on the part of individuals in terms of the liberties that we were taking with our behavior, and also some degree of fatigue down the system, was led to a situation where, when a wave of somewhat differently behaving viruses came, it came as an overwhelming tsunami. This is a given. Now the issue is, how do we respond to this? Above all, the response should be centered around breaking the chains of transmission. I'll come to the supplies part. A lot of my previous speakers on this channel, on this great program that we have set up, have talked about it. Dr. Vijay Raghavan discussed this, for example. But let me say, when you face a situation like this, the most important part is to take measures to stop the chains of transmission. I think even today, much of the dialogue has been, supply side and so on, how to handle situation by vaccines and so on. But please remember, let's change the narrative for a moment now at this point in time, this evening. In the face of this level of calamity, the most important thing that we should talk about is the people's behavior, my family's behavior. And that comes from, even today, we are not wearing masks in the numbers that we should be. Look at the toll that it is taking and the disturbance it is causing. And still you go around in cities and outside into normal places, there are curfews, some places. Still it has not dawned. Can we, for once,
Dr. Paul, we have such a great respect for you, and you're a doctor, you're not a politician. But just to tell you that as an ordinary Indian even, if my Prime Minister, my Home Minister, my West Bengal Chief Minister, my Kerala Chief Minister, if they don't lead from the front, I mean, you know how important leadership is. If you see, say, our top government leaders campaigning in thousands are at rallies, and in the evening having coronavirus meetings and telling me that tell your family to stay at home, surely there's a contradiction. People at the Kumbh Mela told us that corona gaya hai, West Bengal mein corona nahi hai, to Kumbh Mela mein kaise hoga?
You see, the SOPs that were made for both these events that you're talking about should have been followed to the letter and spirit, and they should have been enforced. There are no two thoughts about it. Because ultimately, as I'm repeating it, in order to bring the focus on that side as well, I'm happy to answer your query, but we must bring the focus on our behavior. There is no place for creating crowds. There is no place for not having masks which can protect you.
Absolutely.
That is the only way we can break the chain of transmission. We have the vaccine. There is an approach to scaling up the vaccine. Surely it is important. And then in between somewhere lies this issue of containment, so that the people who are exposed are for a while isolated from the rest of us, so that they do not get infection. This is critical. Can we do it perfectly today? And that will make the biggest difference to the pandemic. Everything else that we are talking about is to look at the effects of this in terms of cases, in terms of misery, and in terms of fighting for lives.
डॉक्टर पॉल, मैं आपसे एक सवाल ये पूछना चाहता हूं. देखिए, इससे पहले कि हम समाधान पर जाएं, और वो उद्देश्य और मकसद है इस कार्यक्रम का कि समाधान ढूंढा जाए, लेकिन एक समाधान इसका ये भी हो सकता है कि वक्त पर ये सारी चीजें पता हो करके अगर उस पर कार्रवाई हो जाती तो उससे बहुत फर्क पड़ता, और उसके लिए सिस्टम कमजोर हो गया, लचर हो गया, ढीला हो गया, लोगों ने मास्क पहनना छोड़ दिया, वो उसके लिए जिम्मेदार नहीं है. जब मैं सिस्टम की बात करता हूं तो मैं बात कर रहा हूं जो लोग फैसले ले रहे हैं. क्या आपको जो जितने रणनीतिकार हैं सरकार में, जो रणनीति बनाते हैं, क्या उनको ये चीज नहीं मालूम थी कि एक दूसरा वेव आने वाला है? और अगर दूसरा वेव इस तरीके से आएगा तो उसकी तैयारी क्या सितंबर से ही नहीं शुरू हो जानी चाहिए थी? आज की डेट में अगर वैक्सीन प्रोडक्शन को रैंप अप करने की प्रक्रिया अगर आप सोचिए जनवरी में शुरू कर दी गई होती डॉक्टर पॉल, तो आज हम इस स्थिति में नहीं होते कि हम आनन फानन में और वैक्सीन को अप्रूवल दे रहे हैं।
संकेत, इसका जवाब जैसे मैंने दिया आपको, सितंबर के आसपास जैसे सर्च चल रही थी, अभी नीचे नहीं आई थी, तो पूरा सोचा प्लान किया गया कि 3 लाख की सर्च भी आएगी तो हम कैसे फेस करेंगे, कहाँ क्या क्या करना होगा और डिस्ट्रिक्ट लेवल पे क्या अम्यूनिटीज होंगी, उसका ब्यौरा, उसकी ताकत और उसको जैसे सुचारू रूप से बनाना है वो था, इसमें कोई डाउट नहीं है, वो प्रिपेयर्डनेस का लेवल था। लेकिन जो दूसरी आप बात कह रहे हैं, जब ये एकदम से आया है तो सबसे बड़ी इंपॉर्टेंट चीज ये भी है कि हम प्रिवेंट करें और उसको आगे ना बढ़ने जी वो भी हुआ, और वो हम सबकी वजह से भी हुआ, एज अ पीपल इट हैपेंड। बट नाउ लेट्स कम टू द इश्यू ऑफ वैक्सीन। आपने कहा कि वैक्सीन क्यों नहीं बनाया, उसके बारे में 2-3 चीजें क्लियर होनी चाहिए। पहली बात है कि देखिए, हमारे पास टू बिगिन विद हमारे पास 2 वैक्सीन मैन्युफैक्चरर, उनमें से एक वैक्सीन मैन्युफैक्चरर वो हैं जिन्होंने एक लाइसेंस बाहर से लिया और बहुत मात्रा में, रिलेटिवली स्पीकिंग, वैक्सीन बनाने का उन्होंने वादा किया, डिलीवर किया। वी सैल्यूट दैट पर्टिकुलर कंपनी। वो वैक्सीन की आगे बढ़ने की प्रक्रिया तभी आती है जब लाइसेंशियर हो जाएगा। किसको पता था ये वैक्सीन चलेगा? क्वेश्चन मार्क तो हमेशा रहता है। दूसरा जो वैक्सीन मैन्युफैक्चरर, वो छोटा सा मैन्युफैक्चरर है। जनवरी के ही महीने में उनको कॉन्फिडेंस आया कि हम आगे बढ़, हमने उसका हर तरह से हाथ पकड़ा, इट इज ऑन रिकॉर्ड। और ये भी एक पक्की बात है कि उन्होंने जैसे जैसे उनको मौका मिलने की बात आई, पीएसयू के साथ जुड़ जाएंगे, अपनी व्यवस्था बढ़ाएंगे। वो फॉर एग्जांपल कोवैक्सीन जो है वो 2 जगह पे छोटी सी फैसिलिटी में, अब 4 में बना रहे हैं, बेंगलोर में भी जा रहे हैं, लेकिन उनको कॉन्फिडेंस आने के लिए टाइम लगता है। हमने बार बार उनसे पूछा था, आपको फाइनेंशियल जरूरत है? नहीं जरूरत है। अब जो बात आती है कि है फाइनेंशियल जरूरत है घूस देने की है, उसका आपस में हमारा अंडरस्टैंडिंग हो गया है गवर्नमेंट के साथ कि कैसे हम इसको सपोर्ट करें। कहने का मतलब यह है कि प्लीज लुक एट द टाइम scale within which it has happened.
But Dr. Paul, then in January, February, shouldn't we have been exporting vaccines? Shouldn't NITI Aayog have said this is not the time to export vaccines? Keep the vaccines here. India will need them, and don't export vaccines. Don't send vaccine Maitri.
Sonia, we must respond to that also. Please remember, a significant part of the export was an understanding of the company with the AstraZeneca, because of which this whole vaccine came into our country. Please appreciate that. ये आप एस्पेक्ट बहुत बताया नहीं जाता कि जब शुरुआत ये वैक्सीन तभी आया कि एक एग्रीमेंट हुआ पेरेंट कंपनी के साथ कि ये आईपी लो बनाओ, और उसकी एवज में कुछ कमिटमेंट उन्होंने की गई। पहली तो वो है। दूसरी कमिटमेंट उन्होंने करी कि WHO की जो फैसिलिटी है पुअर नेशंस को देना, उन्होंने करी। गवर्नमेंट ऑफ इंडिया वाज नॉट अ पार्टी, उन्होंने करी तो उसको डिलीवर किया। जो सरकार ने किया वो इस मंशा से किया कि जो हमारे फ्रेंडली नेशंस हैं, जो नेशंस हमारे साथ हमेशा खड़े होते हैं, यू सी national interest is also linked to interest that comes from friends in the international circle. तो उनको बड़े जुडिशियस तरीके से, that part is only small. वैक्सीन मैत्री के नाम पे only 10 million odd doses have been given. So जो बाकी बल्क गया है वो अफ्रीका के 38, 40, 60 पुअर नेशंस को गया। दूसरा, उनकी जो कमिटमेंट थी उन्होंने पूरी करी, वो नहीं होती तो देयर वाज नो एस्ट्राजेनेका, नो। तो
ये बात सही है डॉक्टर पॉल, लेकिन देखिए
एक बात और सुनो, एक बात और जरूरी है लास्ट, वो ये है कि अगर वैक्सीन को मल्टीप्लाई करना इतना ही आसान होता तो फाइजर इनटू 10x आज तक क्यों नहीं हुआ? वो सप्लाई वही उतनी क्यों रह गई जितनी आप शुरू में? देयर इज अ लिमिट. All vaccines are on different platforms. Not everybody can make. Why the rest of our great industry has not come forward, said we'll multiply this by 20x? It is not easy. These are strategic. आसानी से नहीं होता।
बिल्कुल डॉक्टर पॉल, और आपकी जो समस्याएं हैं उससे हम भली भांति परिचित भी हैं और उसका आदर भी करते हैं। लेकिन डॉक्टर पॉल, एक जो महत्वपूर्ण बात ये है, जो सबसे बड़ी बात है, ये टू प्रिडिक्ट एंड एक्ट, अभी ऐसे लगता है जैसे कि आपके सारे कदम जो हैं वो रिएक्शनरी हैं। वेव आ गई, इस वजह से अब कार्रवाई हो रही है। एकदम से स्पुतनिक को क्लियरेंस मिल गई, एकदम से अब और सरकार इमरजेंसी यूज ऑथराइजेशन की तरफ कदम बढ़ा रही है। लेकिन वो जो 2 महीने का पीरियड था उसमें नहीं किया। मैं जानता हूं आपने कई बार हमारे शोज में ये चीज बोली है कि ये वैक्सीन है, कोई कुछ ऐसा खिलौना नहीं है या कोई और टॉफी या चॉकलेट नहीं है कि आप उसको यूं ही क्लियरेंस दे दें। इट्स अ वैक्सीन, आई रियलाइज। लेकिन आपको नहीं लगता कि एक भयंकर कंप्लेसेंसी थी जिसमें हमने बहुत टाइम वेस्ट किया? एंड व्हेन आई से बहुत टाइम, मेरा मतलब है दिन, ना कि महीने।
आप अब जब बात कर रहे हैं तो इसको आप ओवरऑल ओपन एंडेड मत करिए। अब सुन लीजिए, पूरा सुन लीजिए। स्पुतनिक ने सिस्टमैटिक तरीके से फैसला किया कि यहाँ ट्रायल करेंगे और तब जाके लाइसेंशियर अर्न करेंगे, क्योंकि उनका कहीं और लाइसेंशियर था नहीं। मेहनत करी, उन्होंने अपने ट्रायल पूरा किया, सिस्टमैटिक तरीके से आए और जिस पॉइंट पे उनका वैक्सीन का मैच्योर हुआ उनको मिली। वी आर द फर्स्ट मेजर रेगुलेटर टू हैव गिवन देम ऑफ दैट द लाइसेंशियर। वी आर कंपेरेबल टू FDA, वी आर कंपेरेबल टू यूरोपियन सिस्टम। इसकी अपनी इज्जत है। अब इनको बाकी जगह भी फायदा होगा, लेकिन उन्होंने प्रक्रिया पूरी की। फाइजर ने क्यों नहीं इंटरेस्ट दिखाया? वो भी तो 1600 केस कर सकते थे, दिसंबर में आए थे। इतनी बड़ी रॉकेट साइंस नहीं, हमेशा ये ट्रायल्स होते हैं और उसकी वजह है क्योंकि पीछे जब चिल्ड्रन के वैक्सीन आते थे तो हम एश्योर करते थे कि ये चीजें हमारे देश में भी। आई एग्री कि, और उन्होंने कभी एक्सप्लिसिट ये कहा नहीं कि हमें परमिशन दो, इसके बिना भी उन्होंने एप्लीकेशन दी, वो अपीयर भी नहीं हुए
जी।
तो इसको इस तरह से मत लीजिए। सेकेंडली, मैं आपको ये भी बताना चाहता हूं कि फ्रॉम डे 1 हम फाइजर के, जॉनसन एंड जॉनसन के और मॉडर्ना के टच में है मल्टीपल लेवल्स, और हमें यही वापस जवाब मिलता था कि जुलाई के बाद सोच सकते हैं कुछ देने का, कुछ बनाने का। हमें हमेशा कहा आइए और बनाइए, हमेशा कहा हम फैसिलिटेट करेंगे, बोलो तो सही। लेकिन जवाब ये मिलता था कि अभी हमारे पास कैपेसिटी नहीं है तीनों का, और इसीलिए जॉनसन जॉनसन का भी जो अभी एग्रीमेंट हुआ वो जुलाई सितंबर की बात।
डॉक्टर पॉल, एक और इस सिलसिले में एक और बात ये हुई,
ये भी एक सच्चाई है, मैं ये कह रहा हूं।
नहीं, बिल्कुल सच्चाई है। जैसे कि हमने पहले भी कहा, हम बार बार कह रहे हैं कि आपकी सारी मजबूरियों से हम भली भांति परिचित हैं और उनका आदर भी करते हैं, क्योंकि ये इतना आसान फैसला नहीं होगा। ये कोई दावा नहीं कर सकता कि एक चुटकी में चीजों को कर दिया जाए, बहुत मुश्किल फैसला है, इसका हम आदर करते हैं। मेन बात यह है कि क्या समय की बर्बादी हुई, क्या जल्दी से हो सकता था, कोई गुंजाइश थी? क्योंकि अब होता दिख रहा है।
संकेत बताता हूं, देखिए ये जो ब्लिप आने शुरू हुए, फरवरी में आए, मार्च के अर्ली पीरियड में दिखने शुरू हो गए। सारा ज्यादा एम्फेसिस जो था उस टाइम पे महाराष्ट्र और केरल पे नजर थी, लेकिन यूं ही ये क्लियर हुआ, माननीय प्रधानमंत्री जी ने एक पूरी मीटिंग लेके उनके सामने ये प्रस्तुत किया गया कि ये जो आने वाला है ये सब आने बाकी प्रदेशों में भी जाएगा। उन्होंने अपनी मीटिंग्स ली, सीएम्स के साथ मीटिंग ली, मोर रिसेंटली गवर्नर्स के साथ मीटिंग ली, कैबिनेट सेक्रेटरी लेवल के साथ मिलके स्टेट की व्यवस्था को इंप्रूव करने के लिए मल्टीपल मीटिंग्स हुई, और सेक्रेटेरिएट में, मिनिस्ट्री में मीटिंग्स हुई। ऐसा नहीं है कि तैयारी में उस तरह की तैयारी जो कि यूनियन गवर्नमेंट का रोल होता है, यूनियन गवर्नमेंट काम करती है स्टेट गवर्नमेंट्स के साथ लिखके, सबको साथ तैयार करने के लिए कहा गया, मिलके कहा गया। टेस्टिंग की बात करेगी, कंटेनमेंट जोन के ऊपर एम्फेसिस किया गया है। हाँ, ये बात है कि इतना होने के बावजूद जिस स्पीड से ये वायरस आया, दैट हैज टू बी एडमिटेड, जिस स्पीड से ये वायरस आया है, ये टेक्निकली साइंटिफिकली एंटिसिपेटेड, ये ऐसे दिखता नहीं था ऐसे आएगा। लोकलाइज प्रॉब्लम्स लग रही थी यूके वेरिएंट की वजह से। नॉर्थ में, पंजाब में ये इट वाज विजिबल, पंजाब है, दिल्ली है, इस एरिया में यूके का वेरिएंट, और इसकी वजह से जो स्वीपिंग बदलाव आया है, जो स्टीप राइज आई है, उसने भी जो तैयारी में जो टाइम सब स्टेट्स को, जिलों को मिलना चाहिए, वो नहीं मिला, which is a fact.
I'm just going to Dr. Paul, because we actually have today India's top private hospital health providers. They've all come on because they also want to talk about solutions, because this is an emergency which they also have not seen before. So I'm very happy to be joined by an entire panel of India's top private hospital health providers. And I'll start with Shobna Kameneni, who's with us of the Apollo Group. Have you ever seen a situation like this before? I'd like all of you really, as we go around this Solution Summit, as we go around this panel, to just start by saying, what do you think must be done on an emergency level? Because currently we are in the middle of an emergency. The tsunami is hitting us and we are just trying our best to scramble and find solutions. What would you like to tell Dr. Paul, the government and our viewers on what's needed right now?
Sonia, COVID's been around for a year. We battled this last year. I think we let our guard down. To tell you the truth, the people of India let their guard down. all of us were, the hospitals also, we got into filling the backlog of the other things we needed to do. Business had to go on as per usual in the country. So in doing so, we let our guard down. And I think that this hit us because of the mutant variations that have come. And if you look at it today, situation is, the cases have doubled since last year. Last year, it took 83 days to get here. Now it's 40. I don't know if it's good news, but they're half the deaths. And I think this is also because better medication, better medical protocols. We know how to manage this. But do we have capacity? And I don't think anyone to blame here except people themselves, because I go out on the road. Who said COVID is over? But do you see people wearing masks? Do you see public gatherings being reduced? So having said that, to put the blame on the government or to put the blame on not having enough vaccines or on private hospitals, I think that at this time, we all have to be more positive and say that let's break the chain. And everyone knows the solution. Go ahead, get back to your good behaviors of masking, distancing, stay at home. We don't want those lockdowns. It kills the country in many, many ways. But if necessary, Dr. Paul and his team will have to do it. They'll have to recommend it because that's the way that we got over it the first time. So we need to do this. With regard to the vaccine strategy, come on, give India a clap. We definitely have vaccinated many more people than others. We are not Israel. We are not Germany with small populations. But this is a bad situation. I think that all of us are working together. Hey, we have 6,000 people that today we're treating, and in the hospital, we've taken hotels who have helped us. We're doing it from homes. We're doing it, through telemedicine. We're doing it every way, delivering medicines at home. And sometimes I feel that this deluge, we are not there yet. Please expect another month of this trauma. So anyone who is thinking that we're going to get over it, we'll have many such debates. Please, everyone be responsible. We're all in this together.
बिल्कुल डॉक्टर त्रेहान, मैं आपके पास आना चाहता हूं। एक चिट्ठी आज डॉक्टर मनमोहन सिंह ने लिखी पूर्व प्रधानमंत्री ने प्रधानमंत्री मोदी को, जिसमें उन्होंने तमाम बातें बोली हैं। 5 पॉइंट्स हैं। एक बहुत जरूरी पॉइंट है जिसमें वो कह रहे हैं कि वैक्सीन फ्लेक्सिबिलिटी हो, स्टेट्स को ज्यादा वैक्सीन दी जाए, वो तय करें कि फ्रंटलाइन वर्कर्स कौन हैं कौन नहीं है और उन्हें किसको वैक्सीन देनी है। और उनका ये भी कहना है कि अब आप वैक्सीन को बेसिकली खोल दीजिए, उसको इतना ज्यादा सेंट्रलाइज करके रखने की जरूरत नहीं है। व्हाट इज योर असेसमेंट? हाउ डू यू लुक एट दिस सजेशन एंड डू यू थिंक दिस इज द वे?
ये बात कई बार पहले भी हुई है। ये सोचने की बात है कि केओस क्रिएट नहीं करना है। अब सबसे बड़ी बात जो ये सेकेंड वेव में आई है कि यंगर एज ग्रुप को भी काफी इन्फेक्शन फैल रहा है और कोई आंकड़े कहते हैं कि 50% जो है वो 45 इयर्स से कम एज में हो रहा है लोगों को। तो वो जो पुरानी बात थी कि युवा जो है वो उनको ज्यादा नहीं होगा या उनको इतनी तकलीफ नहीं होगी, ये सब बातें अब सेकेंड वेव में खत्म हो गई है। तो इसका मतलब ये जरूर है कि हमें हर लेवल को वैक्सीन पहुंचानी है। पर जैसे अभी डॉक्टर पॉल भी कह रहे थे कि इसकी एक टेक्निक ग्रेजुएटेड ही हो सकती है क्योंकि इतनी वैक्सीन है नहीं, और जहां भी ये रैंप अप हो रहा है तो अभी आने वाले टाइम में हो सकता है कि आने वाले 4 हफ्ते में काफी वैक्सीन मिल जाए। पर इस टाइम में जो ये टाइम बचा है हमारे पास, जब सारी कंट्री को हम वैक्सीन लगा सकते हैं, पब्लिक को पूरे तरीके से अपनी रिस्पॉन्सिबिलिटी संभालनी है। ये किसी और के लिए नहीं कर रहे आप अपने लिए कर रहे हो, अपने को बचाने के लिए, और अपने को बचाने से आप अपनी फैमिली को बचा रहे हो। आप आज देखोगे जो हॉस्पिटल्स भरे हुए हैं वो बुजुर्गों से भरे हुए हैं जो बच्चों ने दिए उनको इन्फेक्शन। इसकी बात तो आपको हर एक सिटीजन को समझनी चाहिए कि 3 ही जो चीजें बार बार कही जा रही हैं, मास्किंग, डिस्टेंसिंग और हैंड हाइजीन, ये ही एक मंत्र है जो पब्लिक कर सकती है। आप गवर्नमेंट को जितना मर्जी प्रेशर डालो, गवर्नमेंट अपने तरीके से पूरा रिस्पॉन्ड करना चाहिए। दूसरी बात यह है, आपने पहले पूछी थी किसी से कि हमें अब क्या करना क्या चाहिए। हिस्ट्री दोहराने का अब कोई हमें फायदा नहीं है, ब्लेम गेम का फायदा नहीं है, ये जंग है और हमें इकट्ठे लड़नी है। अब ये बात है कि आज के दिन में हमारे सामने क्या समस्या है। हम जो मर्जी कहें कि कितने हजार हमने कर रहे हैं या क्या कर रहे हैं, अभी बहुत बड़ी कैपेसिटी बनानी है। क्या क्या चीजों की कमी है? ऑक्सीजन की कमी अब हम सबको फील हो रही है। ये आज चर्चा चल रही है, डॉक्टर पॉल भी उसमें अपने आइडियाज दे रहे हैं। मिस्टर पीयूष गोयल का भी अभी फोन आया कि हम स्टील प्लांट से कैसे ऑक्सीजन ले सकते हैं। अगर जो वहां से ट्रांसपोर्ट नहीं हो सकती तो ये हो सकता है कि उनके स्टील प्लांट्स के साथ ही 1000-2000 बेड की फैसिलिटी बनाए, क्योंकि 90% से ज्यादा लोगों को सिर्फ बेड और ऑक्सीजन की जरूरत पड़ सकती है। उसमें कुछ एरिया वेंटिलेटर और डॉक्टर्स का भी किया जाए। तो अगर जो हर स्टेट इसको अपनाए कि जहां जहां आपके पास ऑक्सीजन अवेलेबल है, लिक्विड ऑक्सीजन को ट्रांसपोर्ट करने के लिए बहुत सोफिस्टिकेटेड टैंकर्स चाहिए। उसकी तो कमी है, वो तो एक दिन में पूरी होगी नहीं। बट जो आग लगी हुई है वो आज लगी हुई है, हमें सोल्यूशन आज निकालना है। उसमें वैक्सीन भी है, उसमें बेड्स भी हैं, डॉक्टर और हर जितने डॉक्टर हम रिक्रूट कर सकते हैं, और जिस जगह इतना नहीं फैला वहां से ट्रांसपोर्ट किए जाए डॉक्टर, वेंटिलेटर्स, बेड्स, क्योंकि ये सारी कंट्री में उतना ही इफेक्ट नहीं है। ये हर जगह किया गया है, जिसको हम कहते हैं शेयर्ड रिसोर्सेज और शिफ्टिंग रिसोर्सेज। ये हम हर स्टेट के लिए अगर जो करें, या सेंट्रल लेवल से करें, और डॉक्टर पॉल भी सुन रहे हैं, या हम सेंट्रल लेवल से करें, करें कि कहां तकलीफ है।
Absolutely, these are emergency measures we can do now.
हम सब तैयार हैं, प्राइवेट सेक्टर प्रोवाइडर्स जो हैं सारे तैयार हैं।
And I'd like to bring in actually on that, because Doctor, I'd like to bring in Dr. Balal also of the Manipal Hospital, because the private sector, really 80% of India's healthcare is actually with the private sector, which is sometimes, when it comes to, so we see also in Maharashtra that even in Mumbai where people are struggling for beds, but if we go out of Mumbai, the situation is so much worse, even for basics. Dr. Balal, today when we are talking of how to fight a war, how to battle an emergency, what would you like to ask the government and private healthcare providers to do right now and for the long term, for COVID 3.0, for the next tsunami that may hit us, or new mutants and variants? What do we need to get in place now?
Good evening, Sonia and Sanket. Thank you for having me on this wonderful program, and good evening to all our distinguished panelists. We are really fighting a war now. There are two aspects to this tsunami of corona that's happened in the last 6 to 8 weeks. First is, as Dr. Paul rightly mentioned, breaking the chain of transmission. That is not just a short-term issue, but it's also a long-term issue. The second, the very urgent issue is what Dr. Prehan already alluded to, which is taking care of the patients who are already infected. And that is the emergency. And in my opinion, there are some out-of-the-box thinkings that which we have done in the past. We should be doing it again. One is hospital beds are very, very precious. We have to reserve them for the really sick, to save people who need to be in the hospital. A large number of these people can be managed at home with home monitoring devices, home monitoring packages. We can manage them in hotels, which the government has now allowed, which can be attached to a given hospital, COVID care centers, manage them as an outpatient, manage them as daycare, and the only few who are really sick should get into hospitals. This is the first and foremost thing we should do, because we should also realize that in addition to COVID patients, we have a large number of non-COVID patients who cannot be sacrificed because they have waited for a very, very long time to come to hospitals. And for us, any life, COVID or non-COVID, is equally important. The second, which is both the short and long term, is breaking the chain of COVID transmission. And here, any public, any measure in this kind of an issue cannot happen without public support. We have to come down on gatherings, we have to come down on rallies, protest marches, whatever. People should not get together in large crowds, because that's very conducive for transmission of corona. Second, you should increase testing, tracking and isolation of the people who are infected, ramp up the vaccination so that we come to a level of herd immunity at the closest time possible. If we can break the cycle, take the emergency measures we need to ramp up the facilities both for home, intermediate and hospital care, we may still be able to win this battle, but this is a tough call.
Absolutely. Dr. Abhay Soy, Chairman and Managing Director, Max Healthcare, and Dr. Raghuvanshi, MD and CEO, Fortis Healthcare, also with us. Dr. Soy, let me first come to you. There's a very important point that many experts, and I'm sure Dr. Paul must have heard this from a lot of people in the past also, he's been asked these questions also in the past, is to allow private sector into the vaccination drive. Right? Those who can pay should pay for the vaccine, maybe if it is at an elevated cost or an increased cost, and then you can have a subsidized vaccine for everyone in government hospitals or other facilities. Do you think that this stress on a dual strategy could perhaps work going ahead?
So Aniket, I think the first and foremost the problem is vaccine hesitancy on the part of people who have access to this vaccine. Prior to April 1, we saw essentially very few people, it come down to very few people coming up for vaccination, people who had access to it. This was above 65 and so on. And even today, I see the vaccine numbers at private hospitals way below levels and way below our capacity and our potential to vaccinate people. This is perhaps happening due to vaccine hesitancy, happening due to a lot of what people are reading in WhatsApp media and so on and so forth. I want to use this forum to sort of communicate one fact, that nobody, at least that I'm aware of, within my healthcare system and amongst my peers as well, has had a serious or a severe case or has been admitted into an ICU after 2 jabs of vaccine. Having said that, what I see on the ground today is our healthcare centers are, which are vaccinating people, are operating at less than 40% capacity. So it's just people who have access to vaccines don't seem to be coming up, and people who don't have access to vaccines seem to be crying for it. Yes, of course, I think, the way forward is to vaccine as many as possible, at least people who are seeking this vaccine. People who can afford it should be able to pay for it. People who can't afford it are clearly being subsidized even as we speak by the government, because at the government centers is absolutely entirely free. But I think the hesitancy needs to go. If you open it up with what is available to all age groups, I do also believe that there will be a chaos, simply because just the extent of population which is there and would be seeking the vaccine. So you have to do it sequentially. You have to move it from one group to the other. So in that sense, I think perhaps the government is doing the right thing. Having said that, I think within the groups that it's available to, there is a hesitancy. Only less than 50% of the people seem to be coming up. I think, we need to dispel a lot of these fallacies and notions about vaccines out there.
Absolutely.
So whatever we can do as far as that is concerned.
Yes, the race between the virus and the vaccinations, for now the virus is winning. We have to reverse that. But Dr. Raghuvanshi, if you can come in, as I said, private healthcare is so often the savior in health crises and also made the villain. So in that sense, when you see a crisis like this, how do you actually have a partnership between private and public? Because so often, again, the arguments will come that, oh, private hospitals aren't giving beds. There's visuals that come out of people crying outside, whether it's government hospitals or private hospitals, for beds, for ventilators, for medical oxygen. Do we need less regulation in this space? Again, Dr. Paul is here. We're going to come back to you on this, Dr. Paul. But for instance, whether it's a question of medical oxygen, we see states saying, why can't medical oxygen be made in our state and given to us? How do we actually open up the healthcare system in a way that it's less regulated and more available to people who need it at the time they need it? Even the shortages of remdesivir and the other life-saving drugs, even Faviflu antibiotics, ivermectin is not available now.
Yeah. Sonia, all concerns are pretty valid. And definitely there are multiple dimensions to the whole issue and the situation currently prevailing. The private hospitals have always worked very closely with the public sector. And it may sound odd, but I would like to say that the regulation is something which is essential, whether it is private healthcare or public healthcare. Where I disagree is that the private healthcare is judged at a higher level, whereas the public healthcare is not judged at the same level. I think the accountability levels have to be the same for private as well as public health care systems. So that is one point. Now, hospitals are currently struggling and overwhelmed with the number of patients. So it is true that there are patients who are being denied beds because beds are simply not available. But this is a crisis situation. It is unprecedented. It has not happened. The furiosity and the speed at which this second wave came about is sort of something which probably left all of us were unprepared. But the hospitals, I would say, were better prepared this time. And I have been speaking to my colleagues in the industry, and all the private hospital chains were much better prepared, whether it was in terms of supplies, the medicines you mentioned. None of the major players faced any major problems in the supply chain. Of course, we are feeling the pressure now with the increasing load, but we expect in the next 1 week or so, as the production lines also improve, this situation should also become better. The second thing, the hospitals were better prepared this time to isolate areas and also quickly turn around. The protocols were much clearer to the staff, and that has also helped us to convert large part of our hospitals into COVID capacity. But definitely there is still a shortage and a gap in terms of what needs to be done. Private healthcare cannot be a substitute for public healthcare. We have to work together with the public healthcare, and we definitely believe that a moderate regulation which helps us to perform what we are supposed to do rather than hinders us.
Absolutely, because of course private healthcare is in our cities. What about places like Uttar Pradesh, Bihar, where we're seeing cremations, ghats filled with cremations? That's the key issue, Sanket.
Absolutely, absolutely. Zahabia Khorakiwala is also with us, Managing Director of Wockhardt Hospitals. Ms. Khorakiwala, if you allow me, since a lot of suggestions have been given, Dr. Paul, would you want to listen to Ms. Khorakiwala also, and then maybe I can get a reply from you on all the suggestions and solutions that have been offered to the government. I think that was the basic idea of this platform. इस मंच का पूरा मकसद ही यही था कि किसी तरीके से जो समाधान है उसके बारे में चर्चा करके सरकार तक वो आवाज पहुंचाएं. Ms. Khorakiwala, what would you say? What do you think should be the intervention of the government or the suggestions that you may have in your mind for the government?
So, I think if you really look at what we're going through at the moment, which is a second wave, the numbers are unprecedented. We never could have anticipated these kind of numbers. And the problems we're facing now is quite different from those that we faced the first time around. The first time around, we were all grappling with the disease itself, the newness of the disease, and how to manage it. Today, we're really grappling with the resources to treat the disease. And, you know, whether it is testing kits, whether it is availability of oxygen, medication, actual dearth of ICU beds, because the numbers are just so large. So if we were to really think about two things which I think should be the top priority to put in place, A, to tide over the crisis of being able to treat COVID patients, and two, to actually see COVID through and see this disease out. The first would be supply of oxygen, right? Oxygen is life-saving. Without oxygen, we're not able to really do, even do anything for a patient. So I think oxygen supply, securing the oxygen supply. Currently, we're doing a little bit of incremental methods of, pulling oxygen from various places, diverting oxygen which is available elsewhere to hospitals. That will help in the short term and has to be done. But we also need to think about, can we generate more oxygen, and what are the long-term solutions if COVID keeps coming back and continues to be there, and there is this long-term demand on much higher oxygen requirements. Absolutely. So that would be something that the government should probably plan and look into today. The second, of course, is vaccination. That is the only thing that is going to see us through COVID, and the capacities for vaccine creation, more vaccination, manufacturing, all of that should be looked at the long-term pronged strategy for COVID. So oxygen and vaccines would really be the two main things that should be the top priority.
In fact, Dr. Paul, so many suggestions, but just to ask you, Dr. Paul, on that oxygen, ironically, the Scroll has reported that in September last year, the government put out tenders for 150 medical oxygen plants. And today, as we talk in April, not even one of those plants is anywhere near operation. So one, speeding up the government. I know the government red tape is a lot, and I know the regulations and tenders and bids, but we have to be in emergency mode. And two, at this stage, sir, and this is what viewers are calling us all the time, are you going to recommend, would you as NITI Aayog's and head of the task force recommend another lockdown?
So 2 or 3 points. Firstly, on that oxygen plants that you're talking about, the PSA plants, 82 of these plants have been delivered. Several of those delivered are functional, and the others are also in the advanced stages. It takes a while to take them, but then they are there in the pipeline. And also, you know that a massive import of oxygen is also underway, and also additionally, working through diplomatic channels, the efforts are made for additional supplies from appropriate places. Two wonderful suggestions that came up here. I like to enforce them. I think this notion of strengthening home care, so that even today this disease is mild in many cases. It is the progression in some that then takes a different route. So I agree with Dr. Raghuvanshi that home care, supervised home care, facilitated home care, अगर हम उस पे जोर दे पाएं कि रिस्क भी नहीं हो और होम में रहे तो वो सेफ फील करे ताकि बेड्स के ऊपर प्रेशर कम आए, is something, and push it to another level. जैसे पहले के प्रोटोकॉल में थे उससे थोड़ा सा और पुश किया जाए within the zone of safety, I think is a very important suggestion. On the suggestion which Dr. Trehan made about oxygen proximity mega hospitals, there I would very much like to work with private sector in particular, because we can create such a space very quickly. We have the DRDO in particular who can do it very rapidly. Army is on board, BSF is on board. This can happen, and you know that in a matter of 2 days, 500 bedded hospitals come up yet again. But we will need help from private sector for this endeavor for human resources. अगर हम as NAT Health, CII, ये सारे leadership है यहाँ पे, मैं रिक्वेस्ट करूँगा कि अगर हम ऐसा मॉडल बनाएं, ये वाले अस्पताल बनाने के लिए एक पैरेलल काम शुरू कर दें जल्दी से जल्दी, और पर्टिकुलरली जहाँ पे कि पेंडेमिक अभी थोड़ी सी धीमी है and resources are poor, such as Uttar Pradesh, Orissa, and so on. But last पे I want to again please emphasize, you have done a splendid job from your channel about mask and the movement for mask. आज एक अपील क्या हम सब कर सकते हैं कि मास्क पहन लो, बाहर मत आओ, अंदर रहो. Break the chain of transmission. Virus doesn't walk. Virus needs proximity. ये अगर आज हम करें, तो this is a universal vaccine, social vaccine. क्यों हम बाहर आ रहे हैं? अब दिखाई दे रहा है कितनी जबरदस्त इन्फेक्शन हो रखी है. पॉजिटिविटी इन दिल्ली 32%. इसी माहौल को जितना भी हम कर सकें अच्छा होगा. मिनिमम जो लाइवलीहुड के लिए चाहिए वो जरूर है. दिस इज अ वॉलंटरी कर्फ्यू, कोरोना कर्फ्यू जैसे की बात कर रहे हैं. और लास्ट क्वेश्चन आपका ये है कि लॉकडाउन की जरूरत है कि नहीं. The answer to that, Sonia, is that look, national lockdown is not to be. There is no need, because the problems are not in one go similar across the nation. So there is nothing like a uniform lockdown. Why? What is needed is a graded response. Where there is a massive problem, we should go for restrictions to the extent that they are required, and states and districts are taking that approach. And there the approach changes, because you do need to enforce it, because people have not enforced, the health system has not responded. Number two, there are places where we still have some time. Let's say a positivity rate of 10%. We will not allow this to go to 15%. There we go back first and foremost of people's involvement for behavior modification. We go for tests, we go for containment, we go for contact tracing, and we go for massive vaccination there in particular, so that these people are protected. So a dual strategy where things are messy, restrictions are required to break the chain, disperse the people and put them in their own homes in a graded way, without having to do a full-blown lockdown, and then the intensified strategy.
No, so I just wanted the quick last thoughts, Dr. Trehan. Can because as Dr. Paul has just said also, that we know that this is not the peak, that cases are going to rise. We're going to probably cross 3 lakh cases a day, deaths will rise. Can the medical system cope in the current scenario? Delhi is likely to extend this weekend curfew to a week curfew. Maharashtra already has it. Can our medical system cope? Actually, we are all lucky because we are sitting in Delhi, the national capital, and I'm sure your phones are off the hook with people desperate for beds. What's happening in the rest in UP and Bihar right now as we speak, in rural Maharashtra, in rural Punjab, where we don't have these facilities? Can our system cope without some kind of drastic measures, Dr. Trehan?
So, Sonia, there are three ways, and it's Dr. Raghuvanshi also talked about it, and Ms. Reddy also talked about it, that we must break up the three situations in which the patients appear. It is true that all hospitals are on the brink where there are people waiting outside, and within us, we still have this discussion that if we do not produce relief in the very near future, there may be a law and order problem, because people, you can see today, they're taking their dead to the Shamshan Ghat and still, lining up. But this increases. There will be a huge chaos. So I think we need to, that's why I said, let's not talk about the past. Let's talk about what we have today, and let's talk about future preparation. The three things, the message should go very clearly from our channels, your medium, every medium we have, to communicate to the people that do not panic without medical help. Because people use the pulse oximeter, they don't know. In the old days, we said if it drops below 93, rush to the hospital. That's not true anymore. We have understood the disease much better. All day we are spending monitoring many people at home, and many, many more can be monitored at home. Second, we create that halfway facility, which are the isolation centers, which can be monitored by all our hospitals. So like we have taken hotels, and in the middle portion can be put there. And then, of course, so our hospital. So what you're saying is better utilization, more efficient utilization of the systems at hand. More now is the what do we anticipate? What we are anticipating is drug shortage. Remdesivir has become one of the holy grails. So, but I must say the industry or pharmaceutical companies have ramped up, and they are promising from the next week, they will be able to manage that. Some other Faviflu, all these things are under pressure. So we must manufacture, import, whatever we have to do. Oxygen is the more difficult place because there are only two sources.
Right.
One is liquid oxygen, which comes, the manufacturers are manufacturing, have to transport it. Hospital like ours have bullets where we load them, and we used to get a delivery every 2 days. Today we are getting 2 deliveries a day. And I don't know how long it will last, because we are using 20, 30 liters of oxygen.
And that's one of our biggest hospitals in India, which is saying that, yes.
So I think we need to put our heads together and plan this oxygen and creating facilities where people can be accommodated in large numbers with a few doctors and good
hopefully that's begun on this program as well. And the talk with Dr. Paul and all of you, I think, has been so useful. Absolutely. And it's really, thank you all for sparing the time. I know how difficult, what a difficult time it is. Dr. Paul, I can imagine how difficult it is for you as well. So as always, when we ask you tough questions, it's because we also appreciate the work you're doing at this time. Thank you so much, all of you. I know how tough it is being head of a hospital right now.
Sonia, one more fact I'd like to say.
Yes.
When we talk about government and private sector should work together, it is already happening. There has been huge cooperation, not from now, from last year, and it is in the middle. It was like because we had to take care of sick patients who had been left over, non-COVID patients. Now, again, day to day, there are lots of conversations going on.
No, that's
I'm sure we
that's
can
fantastic. But the worry remains that where the private hospitals aren't, I think the public healthcare sector is really what needs to be strengthened so much at this time. But thank you so much, all of you, Dr. Paul and all of you, Dr. Raghuvanshi, Ms.
Dr. Trehan, Dr. Soy, Ms. Kamineni, Dr. Balal, as well as Dr. Raghuvanshi and Ms. Khurakiwala.
Thank you all very much.
Thank you very much. ये बहुत ज़रूरी थी इस किस्म की चर्चा. ये पूरा मकसद ही इस कार्यक्रम का ये है कि समाधान ढूंढा जाए, और शायद ये जो पिछले घंटे भर में हम लोगों ने ये चर्चा की है डॉक्टरों से और सरकार के साथ, उनके सुझाव सरकार के साथ उन्होंने साझा किए हैं. ये एक मुहिम है, एक पहल है कि आगे स्थिति सुधर सके, आगे स्थिति बेहतर हो सके, क्योंकि दोषारोपण और आरोप से किसी को ऑक्सीजन नहीं मिलने वाली. इस तरीके के सुझावों से हो सकता है कोई रास्ता निकल जाए.
Absolutely. We'll take a short break now, but there's lots more coming ahead, more chief ministers, and also a small song looking at what actually you can do, you and I can do to break the chain.